Hello, welcome in. How's everybody doing? Hello. Hello, we're going to do some cardiovascular system today. Hello everybody. I have some cardio plus endocrine planned today, as requested by a lot of you. I also have some... You guys can also send some topic requests to my email at gmail.com. So that's topic requests. But we'll just wait a little bit here just to get in. Probably make this white so it's a little easier to see. Alrighty. Welcome in, everybody. Welcome in. We'll get started here in just a minute or so. But today we're mainly going to focus on the cardiovascular and the endocrine system. I appreciate you guys joining. I appreciate it if you guys would like the live and share the live. The more that you guys like and share the live, the more people we can get in here and help out for their upcoming anatomy quizzes or exams. So once I get a few more people in here, we can get going. Hi, Brianna. My day was very good. How was your day? I finished, I was reading a book called The Will of Many, and I just finished it today. And I'm not very happy with the ending. It was a 5-star book until the last 5 pages for me. Awesome. Thanks for liking the live, everybody. I really appreciate it. How's everyone doing? Welcome in. If you're just joining here, we're going to do some anatomy and physiology questions. I have some topic requests that you can send that we can do in future lives. I linked my email down below. And then we're going to have some cardio. We have more so focused on the blood flow. I have my AMP2 cardio lecture test tomorrow. Awesome. Well, first of all, good luck. Second of all, we are doing some cardiovascular system questions to start. It seems to be a very popular thing. So I have a couple like blood flow questions, circulation. I have some like the ECG questions, and then I have some like clinical relevance questions as well. Hi, Addie. How you doing? If you're just joining, I would appreciate if you like the live. The more that you guys like the live, the more people we can get in here to help out for their upcoming anatomy and physiology exams and quizzes. Thank you for sharing the live. How are you guys doing today? And then for the endocrine, I have a lot of questions focused on hormones and stuff. Kind of like what causes certain hormones to be released, what is their action, and what's the result, what are some of the clinical things that we'll see during that. Doing great, awesome. Me and Mrs. Jim have a cardio lecture test tomorrow. Did I go live yesterday? Yeah, I went live yesterday morning. I uploaded the video of that. I did some muscular system labeling. It's on YouTube now. It'll be live again tomorrow. Thanks for following. I'll be live again tomorrow at 10 a.m. I'm focusing on psychology. That's okay if you missed it. Yeah, we go live pretty much every day, so if you miss one, it's okay. But tomorrow we're doing some psychology stuff. Apparently, a lot of people have been requesting one for their upcoming midterm, like a week or so. But I suppose we can go ahead and get started here. Alrighty. So our first question is going to ask here, what is the correct order of blood flow through the heart, starting from the systemic circulation? So I have to remember our how we always make our heart diagram here. Hello, hello, welcome in everybody, welcome in. Give you guys a couple seconds to answer. Remember we have blood comes from our superior and inferior vena cava. And then where does it go from there? Which moves into the right atrium, which would be here. Our right ventricle, our left atria, and our left ventricle. So blood is going to enter through the right atrium. It's going to enter the right ventricle. It is going to go through our pulmonary artery. It's going to get oxygenated in the lungs. Very terrible at drawing lungs. Kind of doesn't look like a lung, but it gets oxygenated in the lungs, comes back to our left atrium, into our left ventricle, and then out through the aorta to go to the rest of the body. So the answer for this is B. Thank you for answering that question. Alrighty, moving on to number 2. Which valve prevents backflow of blood from the right ventricle to the right atrium? So that would be this valve. There's a good little mnemonic for it as well. Really good little way to remember it. But I'll give you guys a couple seconds to answer that question. Hello, hello, welcome in. If you're just joining, we're going over some cardiovascular system questions. I do appreciate it if you guys share and like the live. We can get this out to as many people as possible. But yes, the answer is D. The mnemonic is try before you buy. So there's the tricuspid and the bicuspid. So tricuspid and bicuspid. Moving on, number 3. Blood leaving the left ventricle enters which major artery? We kind of answered that in the first question, but it is the, remember, artery means away from the heart. Give you guys a couple seconds to answer that question. The answer is B, aorta. Or our left ventricle out through the large artery here, not the aorta. But what is the function of pulmonary veins? So we have pulmonary arteries and pulmonary veins, but what's the function of the pulmonary vein? Awesome. Hello everyone who's just joining. If you're just joining, we're going through some cardiovascular system problems. Then I'm sure we'll get to some endocrine as well. The answer for number 4 is D. It is to carry oxygenated blood from the lungs to the heart. And then number 5, which chamber of the heart has the thickest walls? What chamber of the heart has the thickest walls? Give me guys a couple more seconds. But I appreciate you guys being here. I appreciate you guys liking the live and for following. I'm always trying to help as many people in AMP as possible, but the answer for number 5 is D, the left ventricle. Moving on to number 6. What is the purpose of the pulmonary circulation? Pulmonary circulation. essentially what's responsible for basically the major gas exchange. So I'll give you guys a couple seconds to answer that question, and then we can move on. But also, after a couple more questions, is there anything in particular about the heart that you guys were having trouble learning that we could potentially go over and I can explain? Try to center this a little better. But the purpose of the pulmonary circulation is to, the answer choice is B. It is to carry oxygen, poor blood to the lungs, and bring oxygen-rich blood back to the heart so that it can be pumped out to the rest of the body. Number 7, which valve prevents backflow of blood into the left ventricle? So it's preventing blood from coming back into the left ventricle, as opposed to, it's not going to, it's preventing the blood flow from going this way. The answer to this one is A, the aortic valve. Remember, the left ventricle pumps blood through the aorta out to the rest of the body. So the valve that would be here would be the aortic valve. Moving on to number 8, deoxygenated blood enters the right atrium through which vessels? Yes, it is C. It is the superior vena cava, the inferior vena cava, and the coronary sinus. So if we have our heart here, and in to the right atrium, and then the coronary sinus and coronary veins are like kind of behind. It's in the posterior aspect of the heart. But number 9, the first blood vessels that branch off from the aortic supply oxygen to which organ? Which one would that be? The first blood vessels that branch off from the aorta supply oxygen to which organ? Think of our closest arteries that are going to be off of the aorta. We have our cardiac arteries. So what organ would that supply if they were cardiac arteries? Welcome in. You're just joining. We're doing some cardiovascular system problems. The answer is the heart. So thank you for the follow. Our cardiac arteries. Moving on. What is the name of the valve between the left atrium and the left ventricle? So, give you guys a couple seconds to answer that one. That's that one. Son, it is C. It is the bicuspid. Again, earlier we had the mnemonic, the try before you buy. Moving on to number 11. What does the P wave represent in an ECG? What does the P wave represent? I know a lot of people have trouble with the ECG questions, so we can definitely do some of those. Hopefully, they'll be a little easier, and we can try to make them a little easier. But I'll give you guys a couple seconds to answer that question. The really big thing is kind of remembering what the difference is between depolarization and repolarization. But the answer is going to be atrial depolarization. Atrial because atria is the first to contract. The P wave is the first to contract. The first wave. My favorite lives. Awesome. I'm glad these are your favorite lives. Thank you. You guys are my favorite people to be live too, if that makes sense. It's a really dumb way to put it, but it's true. So depolarization versus repolarization. This is when we're generating an action potential. And this is when we're trying to get back to our resting potential. Alrighty, moving on. Thanks for joining and thanks for liking the lives. I really appreciate it. Thank you for the goat. I really appreciate it. Who sent that? Double CII. Thank you for the goat. I really appreciate it. Thanks for liking the live. Like I said, the more that you guys like the live, the more people it'll show this out to, and we can help with their anatomy problems. But anyway, moving on to number 12. Which part of the ECG corresponds to ventricular depolarization? Give you guys a couple seconds to answer that one. Thank you, everyone, for liking the live. I really appreciate it. If you're just joining, welcome in. I'll give you guys a couple more seconds to answer. Again, we're going over number 12. Which part of the ECG corresponds to ventricular depolarization? The answer is B, QRS complex. And if you guys want any explanations on any of these, please feel free to let me know, and I'd be more than happy to go over it. Especially if anyone's having trouble with any particular topic, or anything like that. What does the T wave represent in an ECG? We're moving on to number 13 now. Number 13 asks, what does the T wave represent in an ECG? So I'll go ahead and let you guys do that. If you're just joining, welcome in. We're doing some cardiovascular system problems. I'm just going over the cardiovascular system. We're eventually going to go through the endocrine system as well after these questions. But thanks for joining and thanks for liking the live. I really appreciate you guys being here this lovely Wednesday night. But anyway, you guys are killing it. It is letter choice D, ventricular repolarization. Let me not cover that up as much. There we go. Anyway, moving on to number 14. The PR interval represents the time it takes for an electrical impulse to travel from where to where. Where else can we find these questions when you're not on live? So they will be on Instagram and YouTube afterwards. So my Instagram is medzig.ollie. TikTok doesn't let me link it for some reason. And then YouTube is my name or link in my bio. That actually lets me link it for some reason. So that's where you can find these questions. So the questions themselves are on Instagram, and the recording of the lives, if you missed the live, is on YouTube, essentially. Oh, wow. Awesome, guys. Thanks for all the likes for the live. I really appreciate it. I looked away, and there was 300 more likes. I really appreciate it. Again, the more that you guys like the live, the more that we can get this out to more people. Thank you for following. It's always great to have some new faces here. But moving on. Again, we were on number 14 here. It asks, I'll give you the answer in just a moment. But the question asks, if you're just joining, the PR interval represents the time it takes for an electrical impulse to travel from where to where. And that'd be letter choice B, from the atria to the ventricles. Moving on to number 15. What does an abnormally prolonged QT interval indicate? What does an abnormally prolonged QT interval? PR just means like, so you have your P, Q, or ST wave. So PR would basically mean like, we have our, let me draw our little ECG here. So we have our P, Q, R, S, and our T. So PR interval would be the interval between P and R. So a PR interval would be basically that. Does that answer your question, Evelyn? So an abnormally long QT interval would, let's change the color to green, would be from Q up to R, S, and then out to T. So it'd be this whole area. Not sure. So it would just be increased risks of arrhythmias. I'll give you guys the answer here, which is C. Because the SA node would be firing right around here, so it wouldn't impact the SA node. But moving on to number 16. Which wave is usually absent or hidden within the QRS complex? But I'll give you guys a couple seconds to answer that one. Again, it's a wave that's usually absent or hidden. It's not really picked up on the QRS, within the QRS complex. But the answer is B. It is the atrial repolarization wave. When our atria our atria membranes are getting back to their resting potential. So number 17 asks, what does a depressed ST interval indicate? Give you guys a couple seconds to answer. You're just joining in, welcome in. The answer is A. It is myocardial infarction. In a normal ECG, which wave follows the QRS complex? Hello, welcome in. If you're just joining here, we're going over some anatomy and physiology questions, particularly for the cardiovascular system. But yes, the answer is the T wave, letter choice D. Number 19 asks, the QRS complex is typically how long in duration? I'll zoom in a little bit as well. Oh boy, I just had to crack my neck. But the answer choice is B. It is about 0.06 to 0.1 seconds. B asks, which part of the ECG... Sometimes that can vary, though, depending on like what your classroom is teaching. It can vary a little bit, but that's typically what's averagely accepted. But anyway, thanks for liking the live. I really appreciate it. Number 20 asks, which part of the ECG is affected by hyperkalemia, which is high potassium levels? So high potassium levels. It's not C. Let me make sure. It's actually peak T waves. Would we need an explanation on that one at all? I can definitely explain that one if you guys want. Yeah, so we can go over that real quick. Alrighty, so high potassium levels, it affects the heart's electrical activity, obviously, and that's reflected in the T wave, mainly due to altering the repolarization phase. So, like a mild more like mild hyperkalemia is like the let me see if I can how should I explain this? So it's going to affect our repolarization, and what causes repolarization is calcium levels. So essentially what this means is, so high potassium levels, meaning we're going to have increased potassium entering the cell. Essentially, when we have higher extracellular potassium, meaning we have a more positive resting membrane potential, so potassium is going to end up higher inside of the cell, and then there's going to be more outside of the cell as well. So that kind of like makes them still, it keeps the cell a little more excitable on the inside. And the T wave represents ventricular repolarization, so when calcium is exiting the cell. So any extra, like excess extracellular potassium would make repolarization happen faster and way more abruptly. So the T wave would be a lot more like tall and peaked. Does that kind of explain that a little better? Okay, gotcha. Yep, no problem. Moving on to number 21. A patient presents with chest pain, an ST segment elevation on an ECG, and an elevated cardiac troponin levels. What is the most likely diagnosis? Thanks for sharing the live. Thanks for joining, and thanks for liking the live. I really appreciate you guys. I appreciate your participation. The answer is B. It is a myocardial infarction. Good. Moving on to number 22. Which condition is characterized by an abnormally prolonged PR interval? Couple seconds to answer. But yes, the answer choice is A first degree heart block. Number 23 asks, which arrhythmia is most likely associated with an irregular rhythm on an ECG? It always tricks me up when I look at that question. Irregular. So the answer is B, is atrial fibrillation. Do we need an explanation on that one at all? I'd be more than happy to explain it if we were unsure. Or we can move on. It's up to you guys. If nobody says anything, I can just move on to the next question. Number 24 asks, a tall peaked T wave on an ECG is most commonly associated with. I just went over this one, so yeah, I should be pretty familiar with it. Yes, it is A. It is hyperkalemia. Number 25 asks, a patient presents with hypotension, muffled heart sounds, and jugular venous distension. What is the most likely diagnosis? Hello, hello, welcome in, thank you for joining. Give you guys a couple more seconds to answer. Again, we moved on to some of our clinically oriented questions. But the answer here, so 25, a patient presents with hypotension, a muffled heart sounds, and jugular venous distension. What is the most likely diagnosis? Which would be B, a pericardial tamponade. Moving on to number 26. Which condition is characterized by a sawtooth pattern on an ECG? What is it by a sawtooth pattern? Alrighty, awesome. The answer is C, is atrial flutter. Moving on to number 27, which of the following conditions is commonly associated with a widened QRS complex? Which of the following conditions is commonly associated with a widened QRS complex? Just a couple more seconds. Again, which of the following conditions is commonly associated with a widened QRS complex? Answer is B, a right bundle branch block. Circle that a little better. Right bundle branch block. Moving on to number 28. Which cardiac condition is associated with an ST segment depression rather than elevation? So when the ST segment is depressed rather than elevated. Give you guys a couple more seconds to answer that question. The answer to that one is an unstable angina. Moving on to number 29. A patient has an ECG showing a complete absence of P waves with a narrow QRS complex and an irregular rhythm. What is the most likely diagnosis? So the answer is A. It's an atrial fibrillation. So the complete absence of the P wave would have to do with the atria. So number 30 asks, which condition is most commonly associated with T wave inversions? Which condition is most commonly associated with T wave inversions? Give you guys a couple more seconds. The answer is myocardial ischemia. So that was all the cardiovascular system questions I had. I'm going to take like a 10 to 15 minute break, and then I'll move on to some endocrine questions. But again, if you were just here for the cardiovascular system questions, they'll be on Instagram afterwards, and then the recording of this will also be on YouTube. And then also I do have some study guides for the cardiovascular system, as well as other chapters in anatomy and physiology. But they're on my website, and they're linked in my bio. My YouTube is also linked in my bio, but Instagram, for whatever the reason, TikTok won't let me link. But again, this is it for you guys. Thanks, and have a good night. Other than that, I will be back in like 10 or 15 minutes.